Welcome back to another episode with Bantering with ByrdAdatto. We've done almost a dozen videos and webinars in the last few months on safety needs to protect your business and practice from COVID in your facility. But what happens when COVID gets into your facility? To address these issues, we have a mini series we've put together for y'all, and we're calling it COVID Questions from Our Clients. So today's question is, Michael?
Today's question, Brad, is if I'm a healthcare provider and a family member tests positive, can I still report to work?
Unfortunately, no. Even as a healthcare provider, if you've been around someone who has been exposed, the CDC believes that you may be symptomatic. I mean, they'd want you to self-quarantine for a time frame in which you can then determine whether or not you didn't have it. There's different time frames. One's a 10-day time frame. One's a 72-hour time frame without certain symptoms. Or the easiest way to get yourself back to work is that you have to get 2 FDA-approved tests within less than a 24-hour period. If you do that and it turns out that that individual who was your family member has quarantined themselves away from you and you test negative on 2 tests with less than a 24-hour period, you can then return to work. So that's it's a kind of complicated answer, but the point being is, unfortunately, unlike a lot of times if you were wearing a PPE at work, you'd be fine. But around a family member, I assume that you weren't social distancing and you weren't wearing a PPE. And so, as you can see, there's a lot to unpack when it comes to COVID. There's so many different laws and regulations, but we're trying to answer each question as they come in. Hopefully, throughout this mini series, we'll be answering a lot of your questions. But of course, if you have any other questions, just reach out to us. So, thanks again for joining us today.